Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Helene Calvet. I'm the Deputy County Health Officer, and I've been here at the County of Orange for about 5 years. I did my medical school at UCLA and then trained in internal medicine at UT Southwestern in Dallas and came back to California to do a fellowship in infectious diseases at Harbor-UCLA Medical Center in Torrance. From there, I was hired on a CDC grant called Faculty Expansion Program to do STD education and research at King Drew Medical Center in LA. And from there, I went to public health, the city of Long Beach, where I was for 11 years, and then came here to the county about 5 years ago. In like 8th grade, I wanted to be a teacher, and then somehow I decided on medicine. Maybe it's because I really liked math and science, and my mom was a nurse, and I saw that helping people was a good thing, and I wanted to do that as well. Internal medicine, that was just, it's tough when you're, I think, in med school trying to decide what you want to do. So it's kind of a process of elimination. Okay, I don't want to deal with kids because they scream and they can't talk to you. And, so I liked internal medicine, but I liked infectious disease particularly because unlike a lot of other issues in internal medicine, a lot of chronic diseases which aren't curable, at least in infectious diseases, you can cure a lot of those diseases. So, I tell people that I'm a physician and they say, well, what hospital do you work in? And I say, I don't work in a hospital. And they look kind of confused and they say, well, what hospital do you work in? And I said, I don't work in a hospital. I work to keep people out of hospitals. And that's what we do in public health. We really focus on prevention and population health. So we would rather vaccinate than have people get a communicable disease. We would rather have them focus on diet and exercise than end up with diabetes or hypertension or heart disease. We would rather inspect restaurants and make sure that the environment is clean so people don't get foodborne illness or get toxicity from chemicals in the environment. So we would really like to prevent disease, keep people out of hospitals, keep people not out of their doctor's offices. They should go there for preventive care, but keep them well. The nice thing about public health, I think, is just that it's pretty much the same throughout the world. I've had a number of wonderful opportunities to teach public health in other countries, mostly through the work I did at the city of Long Beach, but I was able to travel to Vietnam, to Guam, to Saipan, to Mexico, different places, and teach public health practitioners about the management of sexually transmitted diseases. And I just think that's great. Having wanted to be a teacher at one point and now being a doctor, it's a great combination of two. And whenever I go on any of these trips, I really get much more from the trip, much more out of it, I think, than what I'm putting into it. One of my main projects that I'm working on right now is older adult health. So I lead up the older adult health improvement plan work group. I'm working on a report on older adult health. We just launched a website with data about older adult health. I think in many societies, older adults are revered and they're honored for their, contributions to the community. And it's not quite the same here in American society, unfortunately. So I think whatever light we can shine on the needs of older adults is important. And the fact that they're the only age group that's growing instead of shrinking, so that in another 15, 20 years, 1 out of 5 of our citizens here in Orange County are going to be over 65. So we're hoping that this will be an impetus for people to increase services and attention on older adults.